Hello, I am going to be comparing two disorders today, one of them being COPD and one of them being asthma. These two disorders can have a lot of similarities and a lot of differences, but one thing that they share in common that is the main similarity is shortness of breath. But as I researched this for the past 2 days, preparing for this project and gathering all my information, it's been really cool to see just how different that the pathophysiology of these disorders actually is. And so we're going to dive into that a little bit and kind of discuss some things that I've learned from the research that I've been doing recently over these two disorders. So starting out with asthma, this is a more of like a chronic inflammatory disorder, and the trigger for this is a few things. One of them being allergies, like pollen, anything like that, pollutants in the air. Cold air can also be a trigger. Things like exercising for a patient could be a trigger for them. So those are kind of the things that start off with the disorder. And following that, there's going to be inflammatory cells that release a thing called a histamine. And this causes a bronchospasm. And this kind of infiltrates and narrows the lining of the lungs and causes a high mucus excretion. And this causes, again, narrowing of the lungs, which is not a good thing for that patient who's dealing with asthma. With whatever trigger that they've had causing this. But this, fortunately, is reversible and can be treated fairly well. COPD, although, is going to be a little bit different compared to asthma. So COPD is chronic inflammation that is usually caused by smoking. And as we know in America, smoking is very prevalent. And so seeing this contribute with COPD is very, very common for people. The main thing with COPD is that it destroys the alveoli in our respiratory, and this can also cause a loss of lung elastic recoil, which is very hard to reverse. And I'll say this a lot, but COPD and asthma are so different because asthma is reversible as to where COPD is a lot of the times irreversible. The small airways for COPD collapse, and this is going to make the patient have a really hard time breathing. This happens during exhalation. This is going to cause trapped air in the lungs. This is going to cause hyperinfiltration and poor gas exchange. And again, COPD is going to be irreversible. So, although patients with both of these disorders can struggle with shortness of breath, asthma is going to cause a more temporary narrowed airway, as to where COPD is going to have dyspnea, which each of these disorders has dyspnea, but the way the dyspnea reacts is going to be different. And with COPD, this is caused by the damage in the lungs and the air moving in and out of that exchange. As we just discussed, how the gas exchange is lowered, which is making the airway not work as well. Again, one important clinical difference is just the way that these two disorders are either reversible or irreversible. And there's some things that can help, taking, for instance, bronchodilator with asthma, and then while COPD, you're going to have persistent airflow treatments with that. So overall, understanding these two mechanisms and how they work is very influential in nursing in general, because you want to be able to identify the differences and the similarities. And again, the one major similarity being shortness of breath, but it's also figuring out, okay, what's causing that shortness of breath, what's happening in the body. So yes, I am super grateful to be able to understand these two disorders better and be able to compare them for you. So thank you so much for listening.